This is a subject that I always hope and pray will be properly discussed in any Canadian election, whether it be provincial or federal. And right now I'm in Ontario and there's a provincial election campaign taking place. But every time an election takes place, this particular issue is never, ever properly talked about, and anybody who is in a position to talk about it is so scared that they end up climbing up and not saying anything because they're afraid that they will be labeled as destroying the health system or killing the health system or everything else like that. And it's healthcare. That's what I want to talk about. Now, people don't know this outside of Canada. But Canada is suffering from a problem where the ego of our so-called perfect health system is so great that anybody who comes out and talks about the problems with our healthcare system and talk about solutions that would fix the healthcare system are torn up so good and proper, you don't hear about them ever again. It's just over. And that's because even though we secretly, deep down, anybody who has had any form of contact with the health system knows that there are many problems. And I'm not saying we should go to the American system, because the American health system is far worse. I won't even go there. But just because I say, and many people say, that the Canadian health system has many, many serious problems which will only get worse if we don't talk about them. Just because I say that doesn't mean that I'm saying that I want to go to the American system. And anybody who thinks that can go jump in the nearest hellfire. So it's happening now that some in the liberal and socialist corners are saying that Doug Ford wants a two-tier healthcare system. Now, for those of you who don't know what a two-tier healthcare system is, let me explain that to you. So a two-tier health system it can go many different ways, but in a nutshell, it basically means that the way you provide healthcare to the people is different for those who are in one economic situation as opposed to people in a different economic situation. So it doesn't have to be this or this. It can be, it's just different. You provide the health care, you provide the coverage in a different way depending on their economic background. Now, I have said that the best way to have universal health care would be for people who are employed. If you're employed, don't care what you are, you could be a doctor, you could be a lawyer, you could be the shoe shine boy in downtown Toronto. If you are hired by somebody, then your job has the obligation and should be forced to provide, as part of your benefits, free health care from a private insurance company. And as a result, we could say that we could get rid of all the taxes that businesses have to pay. I would agree with that. And instead of businesses giving money to the government, millions and billions of dollars to the government, they use that money that they would give to the government to help their employees with different benefits. And one of those benefits could be health insurance, free health insurance from a private company. The employee pays nothing, zero, nothing from his paycheck, nothing. The business pays 100% of that health coverage so that guy can get free health care insurance from a private. People who are unemployed should be on the OHIP system. Well, in Ontario, it's OHIP. Other provinces in Canada have their own version of healthcare. Our healthcare, public healthcare system is OHIP, Ontario Health Insurance Plan, or something like that. They could be on OHIP, and what OHIP could do is fund all the stuff that they already fund, but also, for the first time, fund pharmacare, fund dental care, fund eye care, and everything else. The only thing I would object to OHIP funding under any circumstances is abortions. If the abortion was, if the pregnancy was voluntary and not due to rape. If it wasn't due to any rape or incest, or the mother's life is in any danger, then you have the responsibility to pay for your own abortion. If it's your choice, it's your consequence as well. But let's get back to this. That would be the best way, because it would ensure that everybody not only has real universal health care, real universal pharmacare, because right now, our health system is very piecemeal. Right now, we don't have coverage, in Ontario at least, and most of Canada does not have coverage for prescriptions. We don't have any pharmacare. So unless you're extremely down and out, you won't get any coverage for your prescriptions. You don't get any dental care unless you are on welfare. You don't get any eye care, and there are many, many different things that Canada or Ontario, because healthcare is covered by the provinces, not necessarily by the country. It's the provinces. You don't even, in Ontario, you don't even get the ambulance ride covered. It's usually a $45 charge if you are taken to the hospital by ambulance, and it doesn't matter what the situation is. That's our healthcare system. It's not completely universal. It's piecemeal universal. It's very ramshackled. Now, the plan that I'm talking about would make sure that all things are covered, but it would also make sure that the budget is in a stable condition. Now, some people might call that two-tier, but I call it common sense healthcare. Now, I'm not necessarily, some people, like some conservatives would say, well, if you're rich enough or you have a certain amount of money, you should have to pay your health care yourself, which, I could agree with that, but I think my plan is even better. But that's two-tier. It's basically trying to say, yes, you can have the universal health care, but we have to make sure that we do it in a way that is economically responsible. Now, we have three options when it comes to universal health care. Number one, we could do what I suggested, or that other people suggest, trying to say that some people get the healthcare, the free healthcare, in a different way than people who don't have the funds to do it. And in a way, you keep the healthcare, but you also keep your budget intact. Number two, you can have what we currently have right now, whereby the healthcare is free, and it's not two-tier. It's all one single insurance, that's it. But it's very piecemeal, and you can't get any pharmacare, and you can't get any dental care, and you can't get eyeglass coverage. And if you have sleep apnea, you don't even get the machine for free. If you're in a wheelchair, you don't get the wheelchair for free. You don't get the ambulance ride for free. It's unless you're literally dying on the street and you are in the hospital, almost nothing is free. That's the piecemeal healthcare system that we have in this part of Canada. Or you could say, well, we'll still have the one-tier healthcare and we'll fund everything. We'll fund the ambulance. We'll give you the pharmacare. We'll give you the dental care. We'll give you the eyeglasses. We'll give you the everything. And the government will pay for it all, everything. And then one day you wake up to find that your debt is so high and the interest that you need to pay on that debt is so high that you end up paying more to pay down the interest on the debt than actually paying to help the healthcare system. And eventually, the politicians will reach a decision where they'll either have to make cuts in other essential services or end up cutting in healthcare. Those are the three options. or you could do what America does and just not cover anybody, which doesn't make sense either, because nobody should have to go in debt or be afraid to go to the hospital when they need to or get care when they need the care. That's not right. I'm saying that we should stop being afraid of this word two-tier. That's just another word that the liberals and the socialists have put out there to make it so that government does everything. But the fact of the matter is government can't do everything. And I'm not saying this because I'm trying to be some libertarian. I don't give no two crap about no damn libertarian. I'm a populist. I ain't no libertarian. Libertarian my foot. I'm not saying that. I'm saying it because it just makes sense. You can't have a system, and especially in Canada, because the country does not run the healthcare system. It's the provinces. Provinces are not countries. And right now, Ontario actually has a very, very high debt. We have the largest sub-sovereign debt in the world. You can't have a situation where the government will pay for everything. All this dental, pharmacare. You know how many people? That would just make it so that Ontario's debt reaches such high proportions that our politicians will end up paying more money on the interest on our debt instead of paying that money that we pay in taxes to our healthcare system and our education system and our and infrastructure and all the stuff that we need. We can't do it. So stop it. Stop it. Stop it. Stop this thing about, don't do anything with our healthcare system. We can't do anything we have the best anyway, so let's just leave it alone. Let's not do anything. The fact of the matter is, yes, we have a pretty good healthcare system, but right now, actually, Canada is falling in comparison to other countries when it comes to good healthcare. And that's a fact. Our population is growing. You have liberals saying they want to bring in all these people from all these different parts of the country. They're bringing refugees. They don't want to secure the border. So illegals are coming in. And then we have people who are coming in legally anyway, like my parents did. And everybody's just coming in. And the country's population is growing. So we have to have a healthcare system, which is, yes, universal, but will also say, look, we have to divide the way we produce the healthcare. I've presented the way I would do it. Other people have different ideas, but we have to divide the way we give the healthcare. It's economic sanity. That's what I'm saying. This thing can't go on no dang longer. Otherwise, we're going to have a pretty messy situation. And I hope this is the election where somebody has the nuts to say what I've just said. This is the Iran Nation.